Good evening and welcome to Talking to Thursday. Now, if this is the first time you have rumbled upon me on a Thursday evening, you're very welcome. I tend to be loitering here with intent every Thursday pretty much for nearly the last 10 years. And the whole purpose is to let you talk about looking after your mouth. The whole idea of growing smiles is to help you actually help yourself because it's your mouth. And often we get very fixated on the dentist or the dental team sorting us out. And if we don't have a dentist or we can't see a dentist or a member of the dental team, we think, we can't do anything. The control is actually in your hands. The primary thing you want to remember is that by and large, the most common dental diseases are preventable. And they're preventable by things that you do, that I do, how we actually look after our mouths every day. And so many of these things that, actually contribute to oral health and having a healthy smile for life are actually things that contribute to being healthy. So having your overall health and your mental health, the whole lot is tied together. And I so often say that, we're not chopped off here. Our heads are not disconnected to our bodies. We are, I'm just going to go back. I don't know why I have got this wrong slide. Anyway, our heads and our mouths are connected to our body, and what goes into our mouths and what goes on inside our mouths. So, when I say what goes into our mouths, so what we eat, what we drink, toothbrush, habits, smoking, all these things have an impact on our mouth. What goes on inside our mouth also has an impact not only on our oral health, but our overall health. So, do we have decent saliva flow? What is our self-cleansing mechanism like? Do we have lots of crowded teeth or old fillings or big cavities or ulcers that maybe make our mouth so sore that we can't clean? So, what goes into our mouth and what goes on inside our mouths really, really do matter. And I think that's really important to remember that because we often think that we are disconnected, our mouths and our oral health is disconnected to the rest of our bodies. And if you even think about how the dental team are trained, they're trained separately to the medical and healthcare team. So we've got medicine and dentistry. Instead of it all being encompassed as a body and a whole entity, and it all amounts to a healthy person and being happy. And World Oral Health Day is tomorrow, and it is a campaign that is driven by basically the global experts, the global leaders of improving oral health. And it's really important that sometimes we just pause for thought. Like a lot of these awareness days, it's sometimes just getting you to stop and think about, actually, well, I haven't really thought about that, whether it's World Cancer Day or transplant day. It's just really to get you to stop and think. And a lot about these Thursdays is encouraging you to stop and think about your oral health. And if you've got a question, fire it down below, stick it in the comments box, because I'm actually in a slightly different setup this evening. I'm not in the little video corner, which means I actually can keep an eye because I've got a couple of screens going here, and it's easier for me to keep an eye on things. So if you see me looking across, it's because I'm just checking what's going on in the comments thing. Okay, so anyway, the whole theme is a happy mouth is a healthy life, and that's what I pretty much just said about your oral health being connected to your overall health and well-being. And the campaign for oral health and World Oral Health Day has been following a theme over these last few years, and it's to encourage sort of positive change and really get people to learn about and take responsibility for their own role in having a healthy, happy mouth for the lives that we lead, because our lives are all different and life changes. So what was right for us as a child, where you're very reliant on parents feeding you or, brushing your teeth, changes throughout your life as you become more independent, as you have some money that that you make choices. I often say that, you then go through a lull when, you don't have a parent to remind you to look after your mouth or make a dental appointment or take you even. And then that changes again as you go through various stages in life, right to the end of life. And, those our older years where we are all living longer. We're all living longer with teeth. So my grandparents wouldn't have had teeth by the time they were my age, the age I am now. So, we've changed a lot in our societal norms and what is normal. Gone are the days that people had all their teeth extracted and dentures to their 21st birthday. And that was not that unusual, not that long ago. We have an expectation of keeping our teeth, but you want to keep your teeth and keep the function of your teeth and keep the appearance of your smile, because that is so integral to your well-being. So I'm just sort of going to have a look. I pulled some of the resources from World Oral Health Day team together and put it together with some of the Growing Smiles stuff. So you'll see that, we are actually all pretty much singing from the same hymn sheet. And how we've expanded at Growing Smiles a little bit more, and the information and the resources that we have that you may well be able to you will be able to access, and hopefully you'll find some of them useful. So let's say 2024 highlighted how oral health supports overall health and well-being. So that was very much setting the scene. Then last year it was focusing on the connection between oral health and mental well-being. So again, that whole mind-body connection, that sort of encompassing our overall well-being as well as our oral health. So really important to remember that it's not just a physical thing. And the FDI, so the International Dental Federation, who are very much driving World Oral Health Day, have a vision for 2030, and that's been fairly recently published, as oral health is a basic human right. But the problem is it may be a basic human right, but you might be surprised that it's not one that's universally enjoyed. A lot of people don't have access to overall health and well-being, and that includes oral health. It's not just a physical thing, it's also a quality of life thing, and access to support of oral health, because I often say the dental teeth are the monitors, the supporters of oral health. The people that are key in actually obtaining and maintaining oral health are ourselves. So yeah, pass the buck back to ourselves. So let's sort of just have a wee look about these key campaign messages. So this is the definition of oral health, and people I'm still finding haven't quite moved into this new definition, and I really like it because it's more than just your teeth. It encompasses that aspect of, your smile, of you being able to eat, you've been able to speak, you're able to look good. And that, I remember donkeys years ago talking to small kids saying, what do you need your teeth for? And it was, oh, you need them to eat, you need them to speak, you need them to smile. That still is so key to our overall wellness as well as our physical wellness, because we can't eat that impact our nutritional status. So if we can't get a variety of foods, if we aren't able to chew foods, we aren't able to swallow, that has an impact. So we need to be able to eat, we need to be able to masticate, for life, basically, for our nutritional well-being. Losing teeth, having ill-fitting dentures, missing teeth, sore mouth, lack of saliva, all impact on our ability to communicate. And speech is so integral, or communication skills. It's not always speech, it depends. You may have other problems that impact your speech, but having a healthy mouth is integral to pronouncing words and forming words. And if you're using sign language or you're lip reading, again, being able to move your lips and move your mouth in a form makes it much easier for somebody who is hard of hearing. So being able to eat, being able to speak, and looking well. And probably we've never been under as much pressure as we are these days for appearance between social media, what is acceptable norms. I mean, it's just unbelievable, the pressure, particularly in young people, to conform to looking good. So, as I say, every stage of our lives is better when we've got a healthy smile. It's, our healthy smile gives us a feeling of well-being. It's how we communicate. If you pass somebody and you smile at them, and you get a smile back, you feel better. If they scowl at you again, it tells you something else. So it's really important to see that as part of our overall well-being. And, if we can build healthy daily habits for looking after our mouths, we give ourselves a really good foundation for having confidence, self-confidence, because we're comfortable and look well, that ability to connect with other people through speech and non-verbal communication, and our ability to thrive. And that all drives into having a healthy, happy life. So it doesn't just stand alone. Oral health isn't just one of those things that it's just something that's there. It's very closely connected to other aspects of our overall health and well-being. It's also really strongly connected to other not very important non-communicable diseases. So things like heart disease, stroke, and what we know about those are there's a lot of common risk factors. So things that will actually impact your oral health can also impact your overall health and well-being. So things like diabetes, which you've heard me go on about before now. And we know that's a two-way street. So, if you're diabetic and you have poor oral health, it's very hard to control your diabetes, and vice versa. But if you get treatment for one, it can help the other, if that makes sense. So gum disease and diabetes are very strongly linked. Think about your diet and what you eat and when you eat. Again, that drives your weight. It can drive tooth decay, can drive acid erosion. So all these things are interconnected. And as I say, many of the sort of risk factors, which we can do something about if we so choose, actually are not only going to drive poor oral health, but they actually impact our overall health. So things like tobacco use, not just means smoking, but even the sort of increase in the use of snuffs by young people, or nicotine pouches or non-nicotine pouches, the drug use, um, alcohol, poor diet and high in free sugars, fat, salt, a lot of ultra processed foods in there. All those impact our oral health and our overall health and well-being. So by managing these, I say manage it rather than control, because I think always control things as if it's one of those things we're going to tie you off about. And I know plenty of people that have come away from a dental appointment feeling as if they have been told off. And often it's because the dental team are trying to get a lot of information in a short space of time, and they've made assumptions. So we get a lot of people come to Grow and Smile really to understand why their mouth is the way it is. And that's what we're talking about. We always talk about, we want to know why. Why is your mouth like this now? And how does that actually impact your overall health and well-being? And that implies your quality of life as well. And I say those common risk factors drive poor oral health and poor overall health and well-being. So, no matter what stage in life you are at, it's really important that you look after yourself. By looking after your smile, that actually has benefits, as I often say, side benefits for your whole body and your mind. So just let's look at the summary of how these oral health messages for this year's World Oral Health Day have been summarised here. And this is Toothy, and Toothy has been this little beaver that has been, he sings and he dances and he does all sorts of things. And if you just Google World Oral Health Day 2026, you'll see all the resources. You'll see lots of fact sheets, lots and lots of information on their website. But the summary pretty much reflects what we're always doing about. It's basically a healthy smile makes life better. I mean, it makes sense, doesn't it? Encouraging brushing for 2 minutes twice a day with the fluoride toothpaste. Visit your dental team regularly. Cut back on the amount of sugary foods and drinks, and that applies no matter what your age is. Try to keep those free sugars, the things that you add to foods and drinks. The aim is less than 10% of your daily energy intake, and preferably under 5% if possible. Now, those are quite technical things, from the point of view, how do you work out what's 10% of your daily energy intake and how's it 5%? So, you know, at Growing Smiles, we like things simple because we're simple souls around here and we like pretty clear messages. So basically, eat well, eat a healthy diet, eat at meal times only, avoid anything with sugar and acids between meals, and certainly the hour before bedtime. Clean well, so brush your teeth thoroughly at least twice a day. Last thing at night and one other time. Take your time, at least 2 minutes. You may well need more than that. And cleaning between every day, that's on top of your 2 minutes toothbrushing. And what you're trying to do with your toothbrushing is brush every surface of all teeth in the gum line. And it will take time, okay? And then look after yourself. So have a healthy lifestyle. So make sure you're physically active. Make sure you're getting enough sleep. We don't give sleep nearly the credit as we should for overall health and well-being. And then make sure you do see your dental team regularly and prioritize that. Yes, it may cost you money, but if you think about some of the other things you spend money on, and it's a cost benefit thing, what are you going to gain in return of making that investment? Because a healthy mouth is much cheaper to maintain than a mouth that actually needs a lot of work by a dental team, whether it be cleaning, gum disease, you know, tooth decay, you know, and those early signs in for both those really common diseases, tooth decay and gum disease, are reversible. So those are very early signs. So that's when you want your dental team to be looking in your mouth and identifying, oh, your risk has changed, that you want to know what your risk factors are, that, you know, maybe you've been putting a medication that impacts your saliva flow. So all of a sudden your ability to buffer and neutralize acids and sugar in your mouth has changed. So it's getting the balance right and, you know, making sure that they can then monitor early signs. Right, we need to increase fluoride in that. We need to do fissure sealant here. We need to do something preventative. We need to give you a bit more advice about cleaning in between your teeth. You need to change the size of your interdental brushes. We need to take that little bit of tartar off around those lower front teeth, because that'll let you clean those surfaces and get your gums healthy again. So all these little things contribute to that team approach to oral health and having a healthy smile for life. So how World Oral Health Day has broken up the messages for oral health. They've broken them up into time, age range, and that's not unlike how we've done it with our timeline. So we have a smile line. So we have a timeline for your smile, basically, from birth to death. Now, what we've got here, World Health Organization have stuck to from babies to old age, which is fine. I'm going to put a little bit of other bits in there as we go along. But basically, and these, keep in mind, these are a global population message. This is not for individual. You will have to tweak this to what fits you and your lifestyle and your family or whoever you're caring for. And that's where we can come in at Growing Smiles, because we do help people tailor prevention to suit their individual, their totally unique set of circumstances. And that's one of the things I love about being an oral health coach, because no two people we come into contact with are the same. So it's always about identifying risk and then what's the least invasive thing we can do to get you healthy and then keep you healthy. So what it's saying is a baby's mouth is where it smiles, giggles, first words begin, and keeping it healthy really helps them grow and explore the world with joy. Think about how babies put everything in their mouth. It gives them so much information. Think about those early sounds they make. Pardon me, about the little chuckles. So you should really wipe your baby's gums after each feed using a clean moist gauze pad or soft cloth. You can use xylitol wipes, which also help create a healthy environment in the mouth, because xylitol has a very beneficial impact on plaque development. use bottles only for breast milk or formula milk or water. Do not put sugary drinks in a baby's bottle. Never put a sugary drink in a baby's bottle, and never leave them with it at night, when you're putting them to sleep. Really important to stick to plain milk and water. Babies and toddlers, that's all they need, breast or bottle milk until the appropriate age, and then actually switch them on to plain cow's milk. And if they've got an allergy, look for the sugar-free, whether it be oat milk or whatever you're switched on to, because so often these things are sweetened and you don't necessarily realize. And just because something says it has no added sugar, that does not mean it's sugar-free. So really important to look at the free sugars, and I've talked about free sugars before here, and you'll find more on the website about that. Try and discourage thumb sucking, pacifier, dummy use, and sippy cups. Babies should move on to a free flow cup about 6 months. So that means when you turn it upside down, I'm not saying don't have a lid on it, when you turn it upside down, the water should drip from it smoothly like that. Don't stick dummies in anything sweet. When the baby needs a dummy, just as a comfort, is a pacifier. If they need a dummy, when they're over to sleep, remove it, take it out of their mouth, and certainly aim to try and get rid of it before their permanent teeth are developing, because it will have an impact on jaw development. So again, we've more than that. We even have a dummy tray where people can go and send their babies dummies when they want to pass them over, and we hang them on the dummy tree. But that's, again, more about that on the website. Thumb sucking, again, it's one of those habits that it can have an impact on development if it goes on and it's continuous and it goes on for a long time. So again, think about what's going in the mouth, what's going on in the mouth, and how that affects. Don't put your baby to bed with bottle. I've said that because, again, that's how you get this early childhood rampant decay. So basically, you nearly have every one of those front teeth ruined before they've hardly been erupted. Aim for your baby's first dental check by their first birthday. That is what you want to do, and certainly by the first tooth appears, which 6 months that's the theory, is your first tooth should come in around 6 months, between 6 months and 2.5 years. All those baby teeth are up, but aim for their first dental appointment by their first birthday. And again, really important that you go why, and that you ask your questions, and the whole purpose. I mean, you don't get a toddler, a baby climbing up into a dental chair, although many of them do, and they love the ride up and down the chairs like going to the moon. But it's an opportunity to get advice, to get some support, to get some personalized advice and looking after your little one's mouth, because you need to be starting to brush their teeth as soon as that first tooth appears. You want to use a toothbrush and a smear of fluoride toothpaste. And I mean, we're talking a grain of rice. A smear of toothpaste is not much. And then make sure that you're doing that last thing at night before they go to sleep, and at least one other time every day. And it'll not take that long initially because they don't have that many teeth. But as that grows, it's important that your little one actually sees it as just part of your bedtime routine, part of your personal care routine. So just having said that, how we actually look at this, and I'm just looking at how we actually have looked at oral health in relation to babies and toddlers. We actually start from pregnancy on the Growing Smiles website, and we look at that life cycle from basically tooth development, because teeth start to develop in utero. So when you're pregnant, you may not even know that you're pregnant when the teeth are already starting to form. And we look at oral health under these headings. So on every age band, and you'll see I'm going to go through them, every age band we look at what you need to think about, what's going on inside the mouth. We want you to think about what about lifestyle, what's going on with your baby's health and their well-being. So if they have allergies, so how does that impact their oral health? About oral hygiene, what you should be doing, what you shouldn't be doing. about their diet and nutrition, and that's sticking with all the guidelines, because the thing about Growing Smiles is what you get is the evidence-based fact, not misinformation. It's not disinformation. It is coming from, generated from those people who spend their time doing the research and coming up with scientific evidence to give me the best tool, and Growing Smiles as a business, the best tools to give you the best advice for your situation. And then what's the professional dental care? So this age group, for mothers, it's going to be, for pregnant women, it's going to be aware that, your gums may bleed, and explain why. For babies, make sure you have a dental home for your child. So I say we break it into a little bit more detail than the WHO have for World Oral Health Day. So just let's take an example here. I'm not going to go through all of these, but inside the mouth, parents' oral health impacts babies. Okay. Mum's oral health in particular has relation to sort of tooth development. So what was the delivery like? What was that early few months? Because again, that can affect permanent tooth development. And we're seeing more and more of a condition called mineral incisor hypomineralization, MIH, and that's where some of the teeth develop, and they sort of like a browny tinge or yellowy tinge, or just even white, chalky white, and they're not as solid as they maybe can be. So, little bit about that. Under the health, lifestyle and well-being, we talk about nausea and vomiting, pregnant women, tooth wear, how to plan for healthy smiles, look after their own as a mum, and also how their general health, any medications, exercise, gestational diabetes, how these things actually can have an impact on their own oral health, as well as the baby's oral health. Oral hygiene, we break that down into the importance of cleaning, again, for mum and for baby, and what to use, what not to use, but cleaning between your teeth during pregnancy, how to actually control that plaque biofilm effectively, and if there's any other aids, any tips, things like that. Diet and nutrition, again, basically what it says in the tin, eating healthily, how to manage and what to do about cravings and control, whether it be a lump of coal or whether it be pickled onions, basically how to actually counteract any potential negative impact from those sorts of cravings. And, think about snacks, think about drinks, about what you choose and when you have them. And then professional dental care, and again, okay, fairly much focused on UK, although we have clients all over the world, and if that's the case, I would always make sure that sort of I find out what is their local situation as far as professional dental care goes. But what is the situation by accessing dental care when you're pregnant? When is the best time to have dental treatment? What you don't want to be doing as far as dental treatment goes during pregnancy, and what should the priorities be for parents? When, as I say, best time to visit? Is there treatment options that you want to maybe put off until after the baby's born? What costs are involved? What to do if you're anxious, because dental anxiety is a very real thing. So that's just how we break it down a little bit more. So we use these headings no matter what age. So, whereas the World Oral Health Day sort of is talking about oral health for babies and toddlers, we go from pregnancy through. So we've got these different stages that we look at. They then take another step into oral health for children and teens. And again, it's about developing healthy habits from the get-go. And you are a role model for your child. And whether you be a parent, a grandparent, an aunt and uncle, a carer, you can influence. And I often say influencer is a very underrated term on our well-being, because I don't mean social media influencers, I mean the people in our lives who influence us. So, you need to, again, have a healthy smile for social interaction. You want the kids to know how to interact with others. You want them to be able to speak. You want them to be able to discover new tastes and eat a varied diet, and certainly build confidence as they grow. So, that oral hygiene thing is really important. And you should be brushing your child's teeth until they're maybe 7, 8, or 9. And I often will say long after that, because your children go through that period of what we call mixed dentition. So there's some baby teeth, there's some permanent teeth. If you've got a baby tooth that's not quite wobbled out yet, children often don't want to go anywhere near it with a toothbrush. But you should be brushing their teeth until, as I say, in and around the 8 years of age, and then you want to be supervising the toothbrushing. And it's not enough just to say to go and brush your teeth. You need to stand with them and make sure they're doing it well. You want to make sure they're brushing every surface of all their teeth in the gum line. You want them to use a fluoride toothpaste. You don't want to let babies to lick or eat toothpaste off out of a tube. I always find it's better if you put the toothpaste on the toothbrush and then let them brush, and then you can finish brushing, if that's sort of an acceptable negotiation. And I've often negotiated that one with parents and children over the years. But children just do not have the manual dexterity to actually handle the toothbrush, to actually brush every surface effectively. Again, still last thing at night one other time, make sure that you're using the appropriate level of fluoride toothpaste for your child's age and their risk. And that's really important, because if your child is higher risk of tooth decay or tooth surface loss for whatever reason, your dental team may well suggest using a higher level of fluoride toothpaste. But again, this is where it's supervised. This is where we tailor it to your individual need, your individual situation. You want to encourage cleaning in between your teeth. Now, I often have this conversation as to when do you start flossing. I always say as soon as they are game for it. So gum chucks are always my go-to with small kids. And it's not that they do it terribly well, but they get to see it as part of their oral care routine. So you can clean in between for them, you can floss for them, and particularly in around these lower front teeth, because kids get tartar building up there as well. And the way to avoid tartar building up there is actually cleaning it really well. And floss is a great way of just keeping that tartar at bay and behind those lower front teeth. So, you can do that for them at least once a day. So again, encourage them to do it, get one-to-one coaching for your child. And particularly as they get older, you want them to have that sort of confidence in looking after their mouth. Dental visits regularly are really important. Your dental team will advise you how frequently that needs to be, because again, it's based on your individual risk or your child's individual risk. If they have got a lot of crowding, or they're missing teeth, and that could be congenitally missing teeth, or that they have been pearly as a youngster, their risk is different to the average. So these messages tend to be very much, the majority of messages you will see are based on an average, population-based average message, oral health message. What we do at Crown Smiles is tailor those messages to suit you, and give you the ability and help you with the tools and the skills to actually get that personalized care plan working for you within your lifestyle, within the way your family operate, basically. So if they do sports, if they do contact sports, make sure there's a properly fit mouth guard. That's really, really important. And it's funny, I was listening to something the professionals saying about having professional fitted mouth guards can work out quite expensive if they have to be replaced quite frequently during the period of mixed dentition with his baby and permanent teeth. But I still think they are well worth that investment, and it's one of those things I wish I had known. So many parents will say to me, once there's a fracture, there's a tooth been knocked out, oh, I wish I had realized earlier. And accidents do happen, but wearing a properly fitted, professionally designed mouth guard where there is a higher risk of a mouth injury is worth every single penny. Sugary foods and drinks, skipped over that one. I really shouldn't, because it is really, really important. If your child will drink water, I often say you're halfway there. Plain ordinary tap water, it saves you a fortune, and make it available all the time, that they've got a water bottle that they're drinking from it regularly. It's great for their brain to be hydrated, it's great for their body to be hydrated, and it's great for their mouth to have good saliva flow. So, save your money on the fizzy drinks and the juices. We don't need them. It's an extra lot of calories that we don't require, as well as an extra hit for ultra processed food, bit like snacking. And if you can eat at meal times only, avoid anything in between meals, you have got much more chance of having a healthy smile for life. The more often and the longer sugary food or drink are in contact with your teeth, the more likely you are going to get a cavity. And that is really, really important to remember, because our society has changed how we eat. There's an awful lot more snacking and grazing. As I say, eating at meal times only, there's a lot to be said for how our ancestors ate and drank. So again, what we do is we break it down a little bit more detail. So we look at 3 to 6-year-olds, 7 to 13, 14 to 18-year-olds. Why? Because each one of those age ranges, there's an awful lot has changed. You're not going to give the same advice and be looking at the same things and having the same concerns in a 3-year-old as you are for 16-year-old. And if you look at that 14 to 18-year-old, I mean, all of a sudden stress has come into it, body image has come into it. So there's different things there that actually really are not applicable to those younger children. But the same basic guides, I've said an awful lot about the basic oral health messages, hasn't changed in 50 years. It's how we package them, how we make them suitable for your situation. And that's what we do at Growing Smiles. So adults, again, you don't know, 16-year-old adult, 18-year-old adult, 21-year-old adult, is it when you can vote? And there's a whole debate about that. But how the WHO and the FDA and the World Oral Health Day is looking at oral health for adults is in this context. So your smile is part of who you are. And having a healthy mouth is good for our whole body, and everything that we do, it just makes life easier in a whole lot of ways. If you've got a healthy smile and you're applying for a job, it gives you confidence in an interview, and people who have nice smiles are perceived to be more attractive. So I say there's all these good reasons for looking after your smile. And again, comes down to the same thing: look after your mouth and it will look after you. So good oral hygiene, and that means brushing thoroughly at least twice a day and taking your time to do it well, cleaning in between every day, and using a suitable tool, whether it be an electric toothbrush or a manual toothbrush. You can do it just as well with either, but you still need to take the time to do it properly. Interdental cleaning, an interdental brush where you can get them, floss where you can't, and use it effectively. And then, avoid tobacco. And that doesn't matter whether it's chewing tobacco, whether it's cigarettes, whether it's cigars, whether it's whatever form, just avoid tobacco. If tobacco became available now for the first time, it would be categorized illegal as a Class A drug. But because it's always been there, it's a bit like alcohol's in the same situation. And, alcohol and tobacco use dramatically increase your risk of mouth cancer. So, really important reasons: don't start, and if you don't smoke, don't vape, so don't start vaping, just because everybody else is doing. And again, it's that those transitional years, I often think, between 15 and 25, where you become more independent, that you're making choices, much more affected by your peers than anything your parents or other family members say. So, trying to look after yourself from a healthy diet, so reducing sugar intake, being active, have a healthy lifestyle, making sure that you do have a well-balanced diet, that you're getting plenty of vitamins and minerals. So that's your fruit and vegetables, because they build healthy connective tissue. You think what holds your teeth in your jaw? Connective tissue, so you want to have healthy connective tissues. And if you are deficient in the vitamins, so if you think about the sailors and scurvy hundreds of years ago, with vitamin C, and their teeth fell out, that was because of their gum health was being affected because they just didn't have adequate vitamin and minerals. And often that can be related to poor diet. So, particularly in those younger years. So really important to do that. I mentioned tobacco and alcohol in relation to mouth cancer, but the HPV vaccine and the HPV virus is really important to remember there, because we are seeing more HPV related mouth cancers than ever before, and we're seeing HPV related cancers in younger people. So again, if you have access to the ability to have the HPV vaccine, and in the last few years boys are now getting it as girls in their teens, take up that offer, please, because it does protect you. And prevention is always better than a cure, particularly with something like mouth cancer, which is such a negative impact. And, with mouth cancers, far too often they're not being identified until it's too late. And it has a devastating effect. So the surgery is radical, the treatment has long-term implications. So they say better to prevent than actually cure, because say the 5-year survival data is not great. Mouth guard, again, if you're doing sports, again, think of the context of what is your risk. So are you a cyclist? Are you using high sugar gels? Do you need to be using those high sugar gels? Now, if you're an Olympic athlete, you're an elite athlete, somebody is managing your nutrition and it needs to be kept in context with that. But then what you want to do is counteract that and balance that out by using a really high fluoride toothpaste, maybe fluoride mouthwash, using remineralizing products as well in there. So it's all about getting the balance that is right for you, whether it be cycling or whether it be boxing, wearing a mouth guard, whether it be whether you be an Olympian or you're going to the gym every day in the week. Drink water, because for most of us that's adequate hydration. Anything beyond that, electrolytes and things like that, is best managed by a nutritionist, and they should, fishy fingers crossed, have access to that information as far as oral health is concerned. And if you've got worries, contact us. I do virtual online coaching, and I spend half my life talking to people online, and that's what we're good at. Extra care if when you're pregnant or you're going to become a parent, and it's not just the woman who's having the baby. I think parents both need to be in a frame of mind that they're looking after their own mouths well, because they are the role models for their children. Their children will copy what you do. And if you don't bother brushing your teeth before you go to bed tonight, your kids are going to just subliminally, whether you're conscious, whether you send them to brush their teeth, like, well, parents don't do it, so why should I? So think about those messages that we are passing on. And it is worth encouraging healthy habits, because, you're instilling a wellness lifestyle, which is only ever going to do them good in the long term. And they are going to live a lot longer than we are. Again, what we do is we take it through these steps. So inside your mouth, look at lifestyle, your health, your overall health and your well-being. Look at oral hygiene, look at diet, nutrition, look at how professional dental care comes into it all. And we break it down into these age bands. So I say, you then sort of get into the 45 to 55, 55 to 65. So when do you become a senior or an older adult? And again, I always think old is 10 years, at least 10 years older than you are at this time. So again, this is another reason why we've broken this down, because each of these stages sees different changes. So, whether it's be becoming a parent, changing a job, traveling, leaving home, to, maybe divorce, menopause, stress, all of these things change throughout our lives. And that's why it's so important to tweak and fine tune your oral health routine and your healthy habits to get you healthy and keep you healthy. And that's where Growing Smiles is here to help you. And there's a sort of a debate, is it, are you still an adult at 55, or do you come into a senior? When do you retire? And again, there's a huge lifestyle change when people retire. And do they go back to work? So lots of questions in there. So let's look at the oral health for seniors. WHO are focusing on basically having a healthy mouth to stay well, keep well, and that allows you to enjoy the food because that helps support a healthy nutrition, a healthy body. And then it also helps to keep your independence so you can live your best life with a healthy smile. So preventive care is key to aging well. And we often talk about aging well, and that should incorporate oral health care routines. So you want to know what your risks are as you get older. Are you at risk of a dry mouth? You want to then compensate and you want to get that balance right. So if you have been putting medication, side effects of the dry mouth, or you notice your mouth is getting dry because your saliva flow is not what it used to be, and the composition can change over time as well, or if you have a cancer therapy, again, that can have a big impact on your mouth. So be aware of how your overall health and medications are impacting your oral health, and then try and get advice to compensate and get that balance right. I often talk about this seesaw thing about, it is about getting the balance right of what is right for you at this time in your life as far as mouth care goes. And again, more than happy to chat with you about that. So you want to avoid any problems because you want to avoid infections, because our immune systems do not work as well as we get older. You want to certainly avoid pain. That's no fun for anybody. Having a healthy mouth and being healthy helps to avoid falls and frailty. And we know poor oral health and frailty that are linked. So looking after your mouth is really important with that, and being able to enjoy a variety of foods, again, really important to maintain your mouth. And also that aspect of appearance and interactions and socializing. Think of the child that doesn't want to kiss granny when they go to visit her in the nursing home because her mouth smells. So those little things, you may be looking after an elderly relative. I always think it's a great thing for a family member to be able to do for an older relative, is to clean their mouth, because often I get asked, I don't know what to do, sitting there looking, there's nothing I can do to help here. Mouth care is one of them, because that is time consuming, and it's a great way you can sing along, and we have got great information from Jim Peterson's team at Knowledge Oral Healthcare about how you help people who have dementia, how you help cleaning mouths in residential care. So again, lots of links of that on the website. So how do we look at it? Again, same things apply. Older people, aging, adults, a lot of the same sort of basic messages. But you still need to think of it in the context of what is inside your mouth, what is going on inside your mouth. Is your lifestyle having an impact? What's your health like? Is it having an impact? What's your mental health like? Are you very anxious? Are you stressed? Have you lost a partner? Have you lost a home? Lots of things change as we get older, and then that can increase your anxiety and your stress, and then that has an impact on your oral health. Likewise, that can have a knock-on effect to your diet and nutrition. If you have always cooked for a family or as a couple and you lose your partner, can you be bothered? Are you eating as well as you should or could be? Are you just having little snacks constantly? And you put that with what's going on in your mouth. So if you've got a dry mouth and you've got recession in your gum, your root surfaces are exposed, all of a sudden your risk of root decay rapidly increases. So as I say, it's a matter about getting all these little bits of the jigsaw puzzle together. That's what I love about doing what we do, because we make a whole puzzle pull together so that we can actually offer you and support you, give you the best advice and support you and help you actually make the progress that you want to have the healthy habits that give you that healthy smile for life. Likewise, your oral hygiene. Our sight's not as good, our hearing's not as good, our dexterity's not as good. Do we need to modify what we're doing, what we're using, when we're doing it? Really, really important. Again, what you're using, as far as toothpaste, remineralizing agents, again, tied in with what's inside your mouth and what's going on inside your mouth. Likewise, access to dental care. If you have gone into residential care or nursing care, well, how are you going to get your own dentist? You've maybe moved away to live closer to family and help with childcare, things like that. That is not unusual. So again, do you have access to a dental team, and what is the situation for actually supporting that? So we take it a little bit further than seniors. We take it right to the end of life. And it is about having a good death. And I have been involved in palliative care for a long time, and I've been involved working with various teams in palliative care and oncology care over the years. And I know how important it is to maintain a level of mouth care um, in those final stages of your life. And I mean, I have done home visits to help people clean mouths literally in their last days. Again, likewise, been in hospital, help people just maintain for comfort, for that social interaction, for that ability to smile with those last days and hours, and be comfortable. Really, really important. So I say, again, we always look at this, with our risk assessment hat on, from, what's going on inside the mouth, what's going into the mouth, what is the lifestyle like at this time? What's what's your health like at the minute? What's your mental health like? Uh, can you clean? Is your mouth easy enough to clean? Can you open your mouth? And all these things have an impact. If you've got a, a, a compromised swallow, again, your diet and nutrition may be affected. And your ability to clean. Again, all these little things interact. And then where do you get the right advice? Where do you get that professional dental care? Do you know how to access, the community dental service, or what happens if you're in hospital, who comes and looks after your mouth? All really important. And that's why we break this whole life cycle of your smile down into smaller chunks. So sorry, messages are still the same. And I say World Oral Health Day tomorrow, the summary of the key messages still come down to you, what's going on in your mouth, and what you can do to look after it. We know that, free sugars are a big, big problem. So reducing those, looking after your oral hygiene, so cleaning thoroughly, having access to regular dental care to support you and monitor your mouth care, and keeping well are really, really key to your overall health and well-being. And if you go back to what I was saying about those key campaign messages of a happy mouth is a happy life, for World Oral Health Day, the FDA, they say that at every stage in life, every stage of life is brighter with a healthy smile, and it's really, really strongly connected to your overall health and well-being. So you cannot chop your head off and think it is not connected or it's not influenced by the rest of your body. It is from the top of your head to the tip of your toes. Your oral health is a key component to your overall health and well-being, and that's why there's no overall health without oral health. I think that is so important that we don't ignore oral health in relation to our overall health and well-being. And those of you who have been here before know that I have just simplified the whole thing, because I'm a simple soul at heart and I like things to be very straightforward because it's just who we are around here. 40 odd years of dental care and helping people look after their smile, has got us to keep these down to what is right for you at this time. And you will know somebody who spends hours and hours and still has problems with their mouth. And you'll know somebody who never sees a toothbrush near their mouth and never has a problem, because they're individuals, and what is right for you may not be right for them. And that's why it's so important to have individualized oral health coaching. And that's why we sort of talk about all the time of eating well, cleaning well, and being well, because that then actually will maintain your oral health and build healthy habits throughout life. And just remember, your age is actually a number. That's all it is. Your mouth will change. Like a lot of things, our fashion style changes throughout life. And sort of, sometimes we have to sort of tweak our oral health to match what our lifestyle is doing. But you can actually play a pivotal role. You are the key captain in your oral health, and that will impact your overall health and well-being. And it is really, really important that we all work together, because dental health, oral health, I always say, is a team sport. Your dental team, you and those you care for, all work together to have a healthy mouth and keep your mouth healthy. So, hopefully by 2030, oral health will be accessible to all. That's the whole aim of the World Health Organization's focus. And World Oral Health Day is just raising awareness of the impact of oral health for your overall health and well-being. So think about it, eating well, cleaning well, being well is really, really important. And Growing Smiles is here to help you. We're here to help you help yourself. And that's the bit that is so integral to having a healthy smile for life. It's what you do every single day. It's not the 15, 20 minutes that you spend in the dental chair twice, 3 times a year. It's what you do every single day that has the biggest impact on your overall health and well-being. So there you go. I am going to stop that share. No, I'm not. I'm going to leave it there with quite like that. I want you to remember about looking after yourself. We're here to help you. And until next week, next Thursday, same time, same place, look after yourself, look after each other. And before you go to bed tonight, don't forget to brush your teeth. Take care. See you then. Thanks for joining me. Night.